Tuesday, February 1st, 2022, regular meeting of the Board of County Commissioners. This meeting is now in order. Welcome, everyone. I'll make a statement first that Commissioner Joe Burney may be joining us a little bit late this morning. He is excused for, I'll announce his presence when he arrives. First thing on the agenda today, Mr. Mokrahisi, is adjustments to the agenda. Do we have any adjustments to today's agenda?
No adjustments from staff.
And from the board? I see none. We'll move along to item 2A, which is a public hearing on order and resolution 22-02-01-01 in the matter of adopting the fiscal year 21-22 supplemental budget number 3, making, reducing, and transferring appropriations and approving employee payments under the approved ARPA project to maintain essential services and workforce stabilization. Mr. Mokrahisi, we have Ms. Christine Moody, our budget and financial planning manager. Ms. Moody.
Thank you, Chair Farr, Commissioners. So as noted, this is our third supplemental budget of this fiscal year. This supplemental is unique in that we have limited it only to budget appropriation changes related to the ARPA funds. The Commissioners, it does sound like people are not muted. I'm getting feedback, just as an FYI.
If we could make sure everyone mutes that's not speaking, that would be great. Thank you.
Thank you. A note that I'll make: the board approved allocations of the ARPA funds that the county has received back in December 14th. And so we're coming to you now with the appropriations that are needed for the rest of this fiscal year in order to start those projects. So two things I'll point out to you. You do have an attachment to this memo that specifically outlines each of those projects, the amount that was allocated by the board, and then the amount that is being added into this supplemental budget. There are also 7 FTE being added in order to do those projects. In addition, as you can see in the title, we are also asking for approval on one of those specific projects that is maintaining essential services and workforce stabilization in order to allow for up to $250 employee payments. So that piece is a part of this supplemental as well. And then we're having the public hearing because we do have 2 funds, our capital fund and then our ARPA fund that are changing by more than 10%. So that's the reason for the hearing. That is my summary. Thank you.
Thank you, Ms. Moody. I'll mention to anybody watching now or in the future that if you go to today's agenda, which is on the county website, and click on View Material, you see the entire document supporting Ms. Moody's presentation this morning. To the board, I'll be looking at the hand raised in the queue. So do we have any questions or comments on the presentation? I see none at this time. Then I am prepared for a motion.
Commissioner Farr, we do need to open the public hearing.
Oh,
sorry. Hopefully you have the script, that I sent you.
And, you know, I am not able to open the script, and I apologize for that. So,
Commissioner Farr, would you like me to find the script and read for your public hearing?
That would be smashing. Thank you, Diana.
One moment. Sorry about that. Just trying to find it as well.
And while you're looking for that, I'll say my explanation, weak as it is. My secondary device, which I look at emails on, is down right now. So all I have is my screen device. So I can't pull up emails at this point in time. And I apologize for this inconvenience for everybody who's participating in the meeting.
Okay, so I do have the script in front of me, and I will begin the purpose of the hearing. This is a public hearing on a supplemental budget for the current fiscal year budget as allowed under ORS 294.471 and ORS 294.473. This public hearing is required under ORS 294.473 due to one or more funds amending expenditures by more than 10% from current budgeted amounts. Notice of this hearing and summary of the changes was published as detailed in the supplemental budget order and resolution included in this agenda item. Participants may testify for or against any item contained in the supplemental budget. At this time, Chair Farr, you would open the public hearing if you would like to do that.
Thank you, Ms. Jones. I will now open the public hearing. Ms. Jones, do we have anyone signed up to testify?
I do see we have some people signed up. At this time, if you have registered to speak at this meeting and you are wishing to speak on this item, which is the supplemental budget, please raise your hand and I will call on you to give your testimony. Chair Farr, I do not see any hands raised, so the next step would be to close the public hearing and ask for additional comments from staff.
Thank you, Ms. Jones. I'll close the public hearing and mention to anyone signed up that public comment will come following employee recognition this morning. Ms. Moody, any further comments?
Thank you, Chair Farr. No additional comments from staff.
Thank you. To the board, questions or comments? I see none. At this point, I truly believe I'm ready for a motion.
Chair Farr, I'll move that we adopt Order and Resolution 22-02-01 in the matter of adopting fiscal year 21-22 supplemental budget number 3, making, reducing, and transferring appropriations and approving employee payments under the approved ARPA project to maintain essential services and workforce stabilization.
I'll second.
Thank you. Moved by Vice Chair Krieger, seconded by Commissioner Buck. Discussion to the motion. This is Mr. Mokrisi, this is a big step today, and we've been moving toward this point for a long time, but it's good to pass this motion today. Seeing no discussion to the motion, I will call for the vote. All those in favor, please say aye.
Aye.
Aye. Any opposed? Passes 4-0 with Commissioner Burney excused. We'll move along to emergency business. Mr. Mokrisi, any emergency business today that you're aware of?
No.
Then I will ask the board anything that you're aware of. Seeing none, we'll move along to item 4, which is employee recognition. Mr. Mokrisi, will you introduce and convene your panel? Thank you.
Thank you, Chair, and good morning, everyone. We're very pleased today. You see a number of folks here with us. We're very pleased to recognize our Human Services Division Rent Assistance Team. So several of the individuals on this team were able to join us today. And I have a few comments. I'd like to introduce the team. I have a few comments, and then I'll turn it over to Eve Gray and Steve Manila for any additional comments. And Stephanie Talbot may have some additional comments as well. So let me first introduce, and I'm going to do my best with all the names. My apologies if I mispronounce. Please correct me. Someone can correct me with a better pronunciation. But I'll introduce the Human Services Division Rent Assistance Team that includes Susan Ban, Alex Dreyer, Megan Hurion, Noelle Lamour, Steve Manila, Mia Masters, Dahlia McMullen, Sarah McNutt, Vanessa Moya Lopez, Daniel Noyune Herrera, Lynn Oliver, and Stephanie Talbot. So this is our Human Services Division Rent Assistance Team. And as the board and many in our community know, since May of 2020, in response to the COVID pandemic, the federal government and the state of Oregon have invested unprecedented funding in ensuring that people do not lose their housing during this public health emergency. Of course, we know the challenge that we deal with on a regular basis related to poverty and homelessness in our community. And one of the best strategies is to make sure that people stay housed. And so thanks to federal and state funding, Lane County has been the recipient of more than $25 million in rent relief. And we anticipate another $14 million in the future. The influx of funding of this magnitude and the urgent need to prevent evictions involved multiple Lane County teams and community stakeholders to mobilize quickly and efficiently. And this is the part of the work that often goes unseen, right? We talk about the resources we receive and the services and the need in the community that we need to deliver. And there's just an expectation that that's going to happen. But of course, when So many resources come at in such a short amount of time, and there's such a significant amount of need and challenge in the community. It's really a significant amount of work to staff up to meet that need. So the Human Services Division did staff up. They hired a team to help get information out into the community, to support our local nonprofits, to distribute the funds, and to maintain a wait list, as well as process applications. To date, 3,773 Lane County households have received assistance paying rent. Lane County's partnership with agencies in Cottage Grove and Florence, as well as remote processing options, have ensured that this rent relief is being distributed across Lane County, and outreach to underserved communities is ongoing. The need for assistance is still great, and the team continues to process applications daily and work closely with advocates to ensure those households facing eviction can seek assistance. It's also important to acknowledge the other county employees who are helping to support this work beyond this team, including the Human Services Data Team, the COVID Call Center, Public Health COVID Case Managers, the fiscal staff who have managed the grants and issued the checks to rental owners, as well as Workforce Services and our Dovetail staff. So we have certificates that we are providing to the members of this team, along with our core behavior Passion to Serve coins. And I just want to offer our sincere thanks for the incredible work to pull this team together, the support from multiple parts of our organization, our community, to deliver to date $25 million and additional dollars in nearly 4,000 households in our community. I'll also just note that there are 3 members of this team that have served as temporary employees. Megan, Mia, and Daniel have served as temporary employees, and it gives you an example, as well as additional staff from across the organization that have participated. It gives you an example of what's required in these emergency situations when we receive this funding, that we really need to have the flexibility to be able to respond there. I'll also note that county administration was successful in stealing Alex Dreyer from HSD, and HSD cannot have her back. So we have this friendly competition that it's always great when we have, if people are going to leave their role, we like to see them leave for another opportunity within the organization. And so we have that friendly competition going on. So again, thanks to this incredible team for the great work that you have done and that you continue to do. And I want to turn it over to Eve and Steve. That flows really nice to add any additional comments. And then I think we'll turn it to you, Chair. And then if Stephanie would like to add anything, that would be great. Eve?
Thank you so much. I just wanted to take a moment to echo Steve's comments with all of you. It really, really phenomenal work. And I think, you know, we talk a lot about homelessness and people who are living in homelessness, and maybe don't talk quite as much about the prevention efforts that, that we are engaged in every day. And without all of you, we would have seen many more members of our community experience homelessness, whether it be for short or longer term periods. And I think it's just incredible work for all of you to come together and really take care of our community during this time of crisis. So thank you so very much for your efforts. And I'll turn it to Steve Manella to make some more comments as well.
I just have to say I'm proud of our rental assistance team under the leadership of Stephanie Talbot. Some of you and the public may not know, but Stephanie, we hired her just a little over a year ago as our energy program supervisor. And when we found out that we had this big lift to get out thousands of dollars of rental assistance in the community, I asked Stephanie if she'd take on the challenge, and she rose to the occasion. So it's greatly appreciated. You know, the incredible work by this team. It was a big lift. It kept thousands of households during this COVID-19 pandemic from becoming homeless. Lane County has never seen a homeless prevention effort of this scale and size. The other thing I want to note is the outreach that was done by this team. There were events done with the NAACP, with Central Latino, coordination with the tribes, as well as coordination with the courts and the Springfield Eugene Tenant Alliance. And that work is very important because this team was able to coordinate with the Springfield Eugene Tenant Alliance to go out and knock on people's doors who otherwise would be evicted, and to make them aware of the program and to get them signed up and to forestall any kind of eviction and get them assistance. So this team has gone above and beyond what would be required of them to do this work, and I greatly appreciate it. Board members?
Thank you, Mr. Manella, and thank you, Ms. Gray. And I'd like to say hi, Susan Ban. I knew you wouldn't go away after you retired from shelter care, and you haven't. So thanks for all your ongoing work. Thanks retrospectively and for the future, Susan Ban. Thank you. And I'd like to say one quick thing about Even Steve. This morning, Ms. Gray, when Steve Mokraisi and others and I were talking about this presentation, he said Even Steve would be giving the presentation. And I thought, you know, I've known Manella for 25 years, and that's a good nickname for Steve. And then I realized it was talking about two different people. So thank you very much. At this point, I'll ask Ms. Talbot, would you like to add some comments, please?
Well, I just do want to thank the work of the team, to their passion for making sure that the most vulnerable people in our community are served, and the overall welfare of their neighbors and the community. Their dedication has just been amazing to witness and to be participating in. We have people who have worked on this for since the inception, like Alex Dreer, people who came in and picked up a heavy load and did a lot of work in a temporary capacity, and then people who are continuing the ongoing work, because as it was mentioned, we still have millions more dollars to get out the door, and more households that need assistance. We're only halfway through this project, and we will continue to work hard for the people of Lane County.
Thank you, Ms. Talbot. At this point, I will look for hand raises from the Board of County Commissioners to see if there's anything that the board would like to say. And I'd like to add that Commissioner Burney, welcome. Commissioner Burney has joined us. Commissioner Buck.
Thank you, Chair. I want to add my appreciation and my deepest gratitude for what you've been doing. You've been meeting people in what is most likely their greatest time of need, and with extreme anxiety. So I know you're working with those folks directly, and you're also trying to navigate a lot of paperwork. I can't imagine what you're going through each time you have to submit one of these applications in order to, get some help out to folks and keep them in their homes. I know that the county is extremely proud of having you on the Lane County team. Thank you so much.
Thank you, Commissioner Buck. And I'm looking for hands raised in the electronic function of hand raised. And I see no further hands raised. I do now. Vice Chair Trieger, followed by Commissioner Burney.
Thank you, Chair. Good morning, everyone. It's great to see you all. I will just echo my deep appreciation and my hey to an old friend, Susan Ban. It's so great to see your face here. I will do a little bridge comment and acknowledge today starts Black History Month. And so I'm gonna quote the great Stacey Abrams, who, political leader, but also a grassroots organizer extraordinaire. And she talks about how good leaders are always at the ready, but they're not always at the front. And the work y'all are doing perfectly exemplifies that, right? You're not out in front. You're not generally here in public meetings with your face on a camera, but you're leaders in the community and helping folks stay housed during this crisis, but I also know it's human work, as Commissioner Buck just mentioned, right? People could log on to a electronic system and submit a bunch of materials and pay stubs and rent receipts and so on, but they need to talk to a person. And I just know, looking at even on these little tiny tiles, those of you I already know and those of you I don't, just looking at your faces, this is work you care about, and that human touch, that is leadership, to be connecting with people in our community and helping them through a really difficult bureaucratic system to help them meet a basic human need. It just can't be underestimated how important the work is you're doing and how much we all appreciate it. So thank you so very much.
Thank you, Vice Chair Trieger. Commissioner Burney.
Thank you, Chair. And it's very good to be with you, commissioners. It's better to be with you than you might realize. First, I would like to say that I really appreciated Ms. Gray's comments. We hear so much about what's not being done and where the needs still are, but there are so many people so dedicated to getting their hands dirty and their forearms dirty and their elbows dirty and really digging in and doing so much to mitigate pain and suffering in our community. Having said that, let me just give you an example and ask a question. I have a constituent, a Latinx woman, who was made homeless even though she had been paying her rent at a trailer park in Springfield. I didn't know what to do. She heard that I would be a person that she could trust, because there's cultural issues even of trust, right, with elected leaders. I called our homeless and shelter strategist. She gave me the CETA, Springfield Eugene Tenants Association. They didn't return this woman's call. This woman has 3 children. They are homeless as I speak. I've been doing everything I can to connect. Where does she go? Who do I refer her to? Because I simply don't know. And I've experienced that much, right, of navigating through bureaucracies to try and find assistance.
May I respond?
Oh, absolutely. I appreciate it. I'm not trying to put anyone on the spot, but I'm acknowledging. Yeah, please.
You may start with Central Latino Americano. They're one of our partners in delivering these funds. They do have the trust of the Latino population. They also have access to, other funds that provided both by Lane County and by other parties that may be able to assist. These funds would be available to help people move into housing who are currently facing homelessness also. But we do have quite a long list we're working from right now. And unfortunately, it's not always immediately available to address an immediate crisis. And I'm sorry about your experience with Springfield Eugene Tenant Association. They have actually been going door to door to help people sign up for this assistance. So
they've been great. Everyone's great. But thank you very much, because that was not suggested, and I will follow up. And that's just an example of the work you all do on the ground. Thank you so much.
Thank you for a good question, Commissioner. And Ms. Talbot, thank you for the response. Looking for further items from the board. I see no Commissioner Bozievich, excuse me.
Thank you, Chair. I just want to very quickly say thank you to the entire team. I see many faces I recognize from over the years, and there are a lot of new faces to me. But I think this team exemplifies a lot of what happens in Lane County as an organization. You guys just stepped in and got the job done. And we just seem to be able to do that in Lane County. And I really appreciate the work you've done. I only wish that some of the IT systems behind you were working as hard as you guys do. So I just really appreciate the work you did stepping in such an unprecedented time. This pandemic has challenged us in so many ways, and so many things that we had to do that we would never have thought were services we'd be providing. Rental assistance, during a pandemic was something I don't think anybody anticipated we'd be doing as a service for the county. And here we are, and you all stepped up and are getting it done in a great way. I truly appreciate the outreach work you've done to some of the underserved communities. And I just want to say thank you.
Thank you, Commissioner Bozovich. I see no further hands raised, so I'll step into the queue ever so briefly. You know, there's not much I can say beyond acknowledging what Mr. Manella said. There has never been an effort of this magnitude in Lane County. That's a direct quote, and I'm going to use it over and over again. There's nothing further I can say about it. You've stepped out beyond the temporary employees, Megan and Mia and Daniel. Thank you for being here for participation. The outreach is amazing. I can only stand in awe and watch from a distance. And Mr. Manella, thank you for pointing out that the Springfield Eugene Tenant Alliance has been knocking on doors. That takes a great deal of fortitude to do that at this point in time. And for them to do that, that kind of outreach is both immeasurable and irreplaceable. So to the team, thank you very much for being here this morning. Congratulations. Mr. Mokrahaisi, I will turn it back to you as we applaud.
Yes. Thank you, everyone. Thank you, Chair, for that time. We appreciate it.
Thank you. And thank you for being here this morning. We'll move along in the agenda to emergency business. Excuse me. We're past that already. We'll move along to public comments. Now today we have a script on public comments board that we kind of brush on, read a little bit every now and then. Today I'm going to read the entire script. This script has been published exactly as it is, as I read it this morning, on every board agenda for a regular meeting for as long as I can remember. And a part of the script that I'm going to pay particular attention to today is the 3-minute limit on public comment. Today, we will be adhering to a 3-minute limit, and I'll explain that after I read the preamble. Speakers will be taken in the order in which they sign up and will be limited to 3 minutes per public comments. If the number wishing to testify exceeds 10 speakers, then additional speakers may be allowed if the chair determines that time permits, or they may be taken at a later time. When there's an additional opportunity for public comment in the afternoon, speakers will be permitted to offer public comment on that same day, only on that topic. If you wish to submit written comment, please send an email to dianajones@lanecounty.or.gov. You'll find that address, also a link to it, on today's agenda, which is published on the county website. In the email, should you send an email, please include public comment for meeting and today's date. These emails will be compiled. Now I'll go back to the 3-minute limit at 3 minutes today in order to make certain we continue with our agenda and don't keep people down the agenda waiting. We will be, Ms. Jones will be asked to silence the mic at 3 minutes. I will be giving a 15-second warning when we're approaching that 3 minutes. If you're looking on a screen, you'll see the 3-minute timer that Ms. Jones will apply to each person's speech. So today, I'll ask Ms. Jones to go through the queue. Ms. Jones, can you call the speakers in order?
Thank you, Chair Farr. At this time, if you have registered for public comment, I'm sorry, I've just lost my menu here. Please raise your virtual hand and I will call you in order of hands being raised, and I will unmute you and you may begin your public comment. The first hand I see is Chris McAllister, and Chris will be followed by Danny. Chris, I will unmute your microphone and you may begin your public comment.
Good morning, members of the commission. Mr. Chair, thank you for this opportunity to speak before you. My name is Chris McAllister and I live in Springfield, District 2, Commissioner Joe Byrne. I'm reaching out to you as we start a new year, as we've overcome so much with the fires, with COVID, and with the weather conditions that have been coming every year stronger and stronger. I want to thank you and the staff of Lane County for the efforts forward, especially recognizing the team at HSD under Steve Manila with Alex Dreer, Amista, also Sarai Johnson, Lynn Oliver. These are people who are making things happen. James Ewell, Maria Cortez. They are not alone. They are standing with the problem-solving organizers and leaders of our community. Roxanne O'Brien, Sean Murphy. These people are serving with lesser resources and greater issues. We've done so much, but we need to be able to do more. We need to take that next extra step. And with the shelter coming, with the camps coming, we need to be able to help support people staying in place. We need to be housing first, but we need to be housing first plus. We need to have wraparound services, teams with mental health services, respite care. We need to help our elders. People are losing their sights in the local camps because they have Parkinson's, because they cannot bladder and they get up out of bed. We have people about to lose their legs. And us as providers are paying for hotel rooms with no form of reimbursement. We have to be able to help while we make these bridges happen. So let's support our new staff. Let's support Kate Budd. Let's support this community with a strong response that nobody will be left behind in Lane County, that we love all of our brothers and sisters and others, and that we will do what we can to keep them alive and help them thrive. Lane County is facing times. Every restored household, with every restored bit of dignity, our people will rise, our tax base will come back, and we will thrive again. My family lost their land in '96 after we had one of our recessions. We are building back as a community, and it takes everybody. It takes every effort, and I'm so honored to serve alongside of you, and I'm so honored to work the tutelage of people for Miss Susan, those who came before her. Thank you, Steve, for your service, Steve Manella, and thank you, Steve Mokorisky, for your leadership. I yield my time.
Thank you, Mr. McAllister. Mr. McAllister also serves as chair of the Poverty and Homelessness Board. Ms. Jones.
Thank you, Chair Farr. Our next speaker will be Danny, followed by Ann Nealand. Danny, I will unmute your microphone and you may begin your public comment.
Good morning, everyone. After 2 years, I finally got COVID. I never feared COVID because I worked really hard on my immune system and exercise. And I was right not to fear it. It was just a cold, nothing different from the colds that I've had throughout my life. And so I just wanted to share that. Everyone I talk to, I have family in other countries and friends and coworkers. And in the last 2 months, pretty much everyone got sick. And the story that I'm hearing is the same across the world. It's just a cold. So it's kind of nice to know that, hey, it's not that bad. Now that the virus seems to be less pathogenic, as the viruses are, when you read about viruses, that is what happens. I just want to say thanks to Steve Adams for looking into the hospitalization data in more detail and sharing that transparently. They only looked at least he only shared 1 day. I think that there's probably more nuggets to discover if we look at larger data ranges. And also, I think that looking at children specifically, hospitalizations will be an interesting project. I have some baseline data that I took before the vaccines were rolled out for children. So I'll be probably pushing for that in the next few weeks or whenever I can. I want to share, I've been diligently asking OHA questions about the rule decision process on a daily basis. It's been really, really hard to get to the bottom of it. They've been answering, but dancing around my questions, really not giving me the answers that I was looking for. Until yesterday, I heard back from Rachel Banks, the director of HOA. She answered all my questions finally after all this time. And it turns out, to summarize, that she is the one that files the rules. There's no voting. And so I am really concerned about that process. And also the fact that she answered after they filed the rule on Friday. So I didn't like that at all. I think that was a lot lack of transparency there. It was kind of not good. And so now they did overstep their boundaries on that rule on Friday, requiring schools, vaccination and stuff. There's already a lawsuit to investigate Pat Allen and Governor Kate Brown. I'm really excited to see that. And more will be coming, especially if she files the statewide rule. We are already cooking some stuff, so I hope that she doesn't, but I have notified her that we're gonna take action if she does. And then I will fight really hard to protect our community here in the county. I'm not gonna fight for the schools, it's not gonna be my fight, but my fight will certainly be this county. And I know the commissioners have the power to shield us, and I will work to help you shield us from the state overreach. Thank you so much for the space.
Summarize.
What's that?
You had 15 seconds to summarize.
Thank you so much. That's it. Have a good day.
Thank you, Danny. Ms. Jones.
Thank you, Chair Farr. Our next speaker is Ann Nealand, and Ann is the last person I show with their hand raised. If anyone else would like to speak following Ann, please raise your hand and I will call on you after Ann speaks. Ann, I will unmute your microphone and you may begin your testimony. Ann, I show yourself muted.
How's that?
Better.
Okay. Good morning. I'm Ann Nealand, and I've come to share some good news. Maybe you've heard it already. The COVID pandemic house of cards is falling. And here's just a few of the cards that have been falling so far. The former vice president and chief scientist of Pfizer, Dr. Mike Yeadon, and 6 other complainants have filed in the International Criminal Court in The Hague, charging 16 perpetrators, including Anthony Fauci, Bill and Melinda Gates, Klaus Schwab, Boris Johnson, Peter Daszak, and other crimes, other people with crimes against the citizens of the United Kingdom, including charges under the Nuremberg Code, charges of genocide and crimes against humanity. Here's another piece of news. The International Common Law Court of Justice has handed down a verdict indicting 75 people, including the Canadian Prime Minister Justin Trudeau, President of China Xi Jinping, CEOs of Pfizer and GlaxoSmithKline, Queen Elizabeth, and others for general crimes of planning, committing, and concealing genocide and other crimes against humanity. Last week, United Kingdom Prime Minister Boris Johnson has announced the end of COVID restrictions in that country, including mask wearing, wondering what scared him. And effective today, the Prime Minister of Denmark announced the end of COVID restrictions, including mask wearing. And maybe you've heard in Canada, the Freedom Convoy has arrived in Ottawa with thousands of truckers in their big rigs and more supporters that are demanding the end of vaccine mandates and tyranny. Justin Trudeau is on the run and takes shelter behind a positive COVID diagnosis despite all his vaccines. Ironic. And more good news, the Freedom Convoy will take shape in the US shortly, beginning its haul to Washington, DC. Maybe Biden will come down with a case of COVID too. The COVID house of cards is falling. Who will get caught in its collapse? Oh, on a second thought, maybe you don't see this as good news. You're in public office, right? You swore an oath to uphold the Constitution. Oh, but you have a bond to protect you from personal liability. Oh, that only works if you have upheld your oath, right? Have you been following directions from Governor Kate Brown and her overreaching tyranny-prone mandates and government money flow? Do you feel safe in her shadows? I wouldn't be too sure. I told you about the accountability afoot in the international venues, and you can be sure the accountability chicken is coming home to roost. Kate Brown is planning her escape to a liberty-minded state of Idaho when her term is over and a Republican takes office. Where will you all be hiding when accountability comes to Oregon?
You have 15 seconds.
To Eugene and Springfield. Don't worry too much. You can always take cover behind a positive COVID diagnosis too. Thanks and good luck.
Thank you, Ms. Nealand. Ms. Jones, is there anyone else signed up for a comment?
I do not see any additional hands raised at this time, Chair Farr, so I will return the meeting to you.
Thank you, Ms. Jones. At this point, Commissioners, I'll ask for a response to public comments and or other issues or remonstrances, and I'll look for the electronic queue. Vice Chair Trieger.
Thank you, Chair. Just a quick thank you to folks who hosted me for a tour. I had the chance to go out to the new parole and probation site at Four Corners, Highway 99 and Roosevelt Boulevard last Friday, and it's just a beautiful facility. Folks there are clearly so appreciative, our workforce there, to have an environment in which to do their really important and really difficult work that supports not only the function of their work, but just the dignity of what they're doing with the clientele that they serve. And I just want to really appreciate my colleagues and all the staff for all the hard work over the years that went into us being able to acquire and remodel that building and locate parole and probation out in their new home, where folks who come on supervision for services get to see an aspirational environment to the life that they're working towards. And so I just wanted to offer that appreciation and thank you very much. That's all this morning.
Thank you, Vice Chair Trieger. Welcome to Bethel. I see no further hands raised. give it a moment to see. I see none. Then I'm just going to mention one thing, and that's something I failed to mention when Mr. Manella was here with us. And I sometimes say this, Mr. Manella is in the conclusion days of his career with Lane County. Something I'll mention, many years ago, Steve Manella hired someone called Caroline Frengel, who was the first executive director of Food for Lane County. Steve Manella planted the seeds and roots of Food for Lane County. He was the originator of Food for Lane County, nonprofit that everybody knows. Also, the federally qualified health centers as a concept that started here in Lane County when Steve Manella originated the concept, and it became a pretty popular concept. It's in use throughout the nation. Mr. Manella has been instrumental in breaking trail for not just Lane County, but for the entire nation. Thank you. I see no further hands raised. Then we will move along to, let's see. We will, at the sound of the gavel, I will recess the Board of County Commissioners, and we will reconvene as the joint meeting of the Board of Health and Board of Commissioners. The Board of Health, Board of Commissioners is now in session, and we have adjustments to the agenda. Mr. Manella, any adjustments to today's agenda? I said Mr. Manella, I meant Mr. Mokohaisky, sorry.
No.
Thank you. Then you're both called Steve.
Both Steve M's.
Steve M's, that's right. But we know from earlier in the meetings that, that the other Steve is now even Steve, right? So do we have any emergency business today, Mr. Mokohaisky?
No.
I see none. Then today we'll move on to item 3A, which is a discussion of the COVID-19 response and recovery. Mr. Mokohaisky is our administrator, and Steve Adams, you are the chief panelist today. Mr. Mokohaisky, Mr. Adams.
Thank you, Chair. And I'm going to turn it over to Steve, and Dr. Warren is with us as well to walk through an update, and we'll be happy to answer your questions.
Thank you.
Good morning, Chair Farr and Commissioners. It's a pleasure to be with you once again this morning. I am able to present current data, this morning's data to you. This morning, we are currently reporting 490 new cases in the last 24 hours. That is 50,626 on the pandemic. We are currently reporting 2,422 individuals within the 10-day infectious period. That's a decrease of 24. We are reporting 88 Wayne County residents in hospital currently. That is an addition of 16 in the last 24 hours. And we're showing 15 Wayne County residents in hospital. That's a decline of 1 in the last 24 hours. For all COVID-19 patients in Wayne County hospitals, we are reporting in OSCAP this morning 98. That's 77 at Riverbend, 21 at McKenzie-Willamette as of this morning's data. And we are reporting a total of 19 individuals in our ICU units. Our case prevalence, a 7-day moving average is 1,085 per 100K of population. I don't have a spot check available this morning. As I presented last week, of these individuals in hospital who are there for primary COVID-19 symptoms versus those who are there for treatment, other treatment, and have been detected as having COVID by virtue of normal infection control and screening processes. I am pleased to report that our hospitals continue to provide, are able to provide ongoing elective surgeries and other treatments. So COVID has not sidelined our hospital treatment capacity as of yet. We are here just again looking specifically at the pandemic as a whole through the familiar epi curve, which continues to put past incidences into relative scale. Just as I look back, today being the first day of February, looking back, January has been quite the month. We reported a total of 18,042 cases of COVID-19 in Lane County during that during that single month. That is just shy of 4.7% of our total population. We know from CDC estimates that 1 in 4 COVID cases are not likely to be officially tallied in our lab systems due to unreported home tests or those individuals who did not receive tests. So we know that the number is significantly more. This single month represents about 35.6% of our total caseload in 2 years of this pandemic, which is quite remarkable. I think just in a moment of reflection, just working with the staff here who has been trying to flatten the curve for 2 years, it has been mentally challenging to just see this volume of cases come through our process. So I just a continued appreciation to our case investigators and others who continue to support childcare, schools, hospitals, congregate facilities, and other first responders as they continue to try to provide services to the public. I wanted to present some data that our team was able to put together. Commissioner Bozovich had requested some trending data over time that really helped us look at cases, which you see in blue, hospital admissions, which you see in yellow, and deaths, which you see in red in this graphic. So this graph takes a moment. The case scale, the blue curve is scaled on the left-hand side of your screen. The hospitalizations and deaths are scaled on the right-hand side of your screen. These are 7-day moving averages, and these are characterized as point-in-time measurements, right? And trended on a 7-day moving average. So for instance, you will see the yellow curve just passing 15 new hospital admissions per day on the 7-day moving curve, just to give you a sense of that. So I think what is most remarkable, you see some of the time periods keyed here. You see the winter surge of 2021 here. You see the UK variant or the Alpha variant bump here. You see the Delta period, and then you see where we currently are with the Omicron. And this kind of sharp decline is not a real case observation. This is merely a weekend case reporting effect, as the team calculated this yesterday. So we think we're getting past the point of peak. Our fingers are crossed, but you can see that hospitals and deaths lag cases. Now, what is most remarkable is the decoupling of cases and hospitalizations in this latest curve for our Omicron period. So we have seen a dramatic increase in the number of cases reported and those that are unreported, and we see specific results of that. That is a function of the Omicron variant being less severe. It is also a function of the greater degree of immunity within our population, both in terms of prior infections, but also in terms of vaccinations and boosts. So this is good news for us. As we look forward, hopefully we'll be cresting our peak hospitalizations. All of our institutions will be working through, hopefully, a declining case count, which will mean a lesser number of individuals calling in ill for shifts. Folks will be able to provide those services moving forward, and we can begin to return to some semblance of normalcy beyond this particular surge. So on the vaccination front, we continue to see steady progress. So as of now, we're reporting, as of yesterday, 71.5% of our total population having received at least 1 dose. I was really cheering hard to think that we could hit 70% by the end of December, by the end of the year, and we did. So just in that amount of time, we have added another 1.5% of our total population. Interestingly, OHA is now reporting on time to completion data, and we are seeing 98% completion, meaning that you get that second shot by week 8. So by 8 weeks, folks are getting fully vaccinated. So we can see that that is cleaning up nicely. Last week, we talked a little bit about the zip code data and really wanting to drill in. So the last time I presented this zip code data to the board was the 13th of December. It was the 14th of December, and I pulled 13 December data to share with you. And so pulling yesterday's zip code data to present to you, we see some changes. I think, not huge by virtue of a magnitude of change, but certainly as you see particular zip codes increasing by 1.5 to 2 percentage points. Those are hard-won shots at this point. These still represent primary shots, right? So first or second doses of the mRNA vaccine or the first shot of the Johnson & Johnson. These don't represent boost shots. I don't currently have data for boost doses at this level of granularity to be able to share with you. But as we have reported, we have transitioned our mass vax operations to state government. OHA teams are now operating at Autzen Stadium and at the Riverbend Annex and providing a drive-through option as well as a walk-in option for individuals seeking first and second doses or seeking boost doses, all ages, all vaccine types. And this frees us to really focus our resources specifically to provide more agile, more mobile activities. And I really, as this aligns really from a public health policy perspective and what public health here in Lane County will be focused on, I really want to defer to Dr. Warren to really outline her vision and the team's vision for moving forward.
Thank you, Steve, Chair Farr and Vice Chair Trieger. There's been a lot of conversation, I think, at the state level too, about the future of public health and what really is our role coming in this kind of transition period from public health and delivering COVID vaccination and testing and treatment. There's also been a lot of discussion about what does it mean to center equity in public health work. And I think something that we have really learned throughout this pandemic is that this pandemic has not had kind of equal effects across groups of people. We have seen very disproportionate impacts among communities of color, folks with disabilities, and some other marginalized groups in the county. And thinking about what is public health's role in securing the health of all people in Lane County, thinking about what has to change, and something that an approach that we have always taken in public health from a population health perspective is really the greatest good for the most people. And on the face of it, that sounds good. That sounds like you're really maximizing health to the extent possible. The problem with that, I think, on a practical level, is that although it's unintentional, there can be instrumental harm in that approach, in that it is the same groups of people always that are not prioritized. If you look at the greatest good for the most people, who the most people are and how they're defined tend to be the same people over time, again and again and again. And that is what we mean by sort of structural racism, and why the systems that we set up can have these differential impacts. So, for example, as we're coming out of COVID and thinking about how do we do things differently in public health now to actually center equity and make that our goal, one of the things we want to focus on are these groups of people that don't have equal access, that don't have the same rates of vaccination that we see among other groups. And that will be our focus. We will be doing more small clinics, more targeted clinics, working more with our community-based organizations and doing in-home vaccinations for those who request it. We have really focused on numbers throughout the pandemic. What is our total vaccination rate? And with the governors delivering 1 million additional doses of vaccine through the end of January. And in the terms of vaccination, that's a great goal, because we know that every shot in an arm is a benefit to everyone. It protects the whole community. So vaccinations are not an individual level good alone. But at this point in the pandemic, we think it's really important for us now, especially with these additional Oregon Health Authority resources available to us now, to make our focus reducing the health disparities in our community. So that is going to be our goal, not only for vaccinations, but across a wide range of health outcomes now, as we start to potentially, I hate to jump the gun and say now we're looking forward to COVID sort of receding a bit, because every time we have thought that perhaps we were on the other side of that, we were wrong. So I don't want to get ahead of us, but we do need to think about what does public health look like for the future, and what are we going to do differently. And this is at the forefront for us, and will be the first thing that we do differently, is how we prioritize our own resources. Thank you. I also, actually, if I might add, I did last time I was here say that I would do a little update on treatments that are available. I think that COVID treatments are also an essential part of how we get past the pandemic. The vaccination is number one, but we also have seen a lot of treatments that have been evolving over time. Some have been effective and then been less effective against certain variants, but it really, I think that this is also a success story, is that we have now the National Institutes of Health, and this is information that I get directly from Dr. Pat Ledke. So this is the information that he shares with his weekly provider call that has continued throughout the pandemic. I think is one of the other kind of real successes we can point to in our response. They have been talking about the availability and the prioritization of treatments, and refer to the National Institutes of Health guidelines. There are really 4 now that are prioritized. 3 have very equivalent rates of success at over 80% in relative risk reduction for hospitalization and death as compared with placebo. The difference, of course, is some of them are intravenous and some are oral. And being able to take an oral antiviral is, of course, far easier and far preferred when it's possible. We do have sort of, constrained supplies of a lot of these, but the oral nirmatrelvir and ritonavir, those are co-administered. That's preferable and number one, because it's twice daily for 5 days, and it is very effective at halting any progression for severe disease. So I think that also explains why we're seeing lower hospitalization and death rates that we might otherwise see. So I just want to note that those are also a part of the success of the response, and locally the hospitals are also prioritizing those, as well as providers, because those are prescribed for people who are not hospitalized. They're therapeutic options that can prevent hospitalization and death. So that is really helpful. It's and then they also have prioritized groups. So immunocompromised people who don't mount a good response to vaccines are prioritized, as well as unvaccinated adults over age 75 or unvaccinated adults over age 65 with clinical risk factors, because that comprises the group that are most at risk for hospitalization and death. And then there are others as well, but I do want to share that because I think that that's a big piece of our puzzle locally that we don't necessarily have any direct impact on, but it really in the clinical community, and it's making a big difference in our numbers. Thank you, Chair Farr.
Thank you, Dr. Warren, and thank you, Mr. Adams. At this point, I'll turn it over to the board for questions and/or comments. I will be looking to the electronic queue for that. Until I see a hand, I'm just going to, I see a hand, so I'll wax later. Commissioner Bozievich.
Thank you, Chair. So I want to get to something about masking in children in a minute. But first, I want to challenge a statement that Dr. Warren made about vaccination protecting the community. At this point with Omicron, there is no evidence that vaccination prevents getting the virus or transmitting the virus, that there's any major difference between being vaccinated and unvaccinated as far as the ability to transmit. But there is significant evidence that being vaccinated lowers disease severity. So I would challenge the statement that vaccination is about protecting the person that's vaccinated. And at this point, no one's talking about herd immunity anymore, because we all understand it's never going to happen with a coronavirus. And we really should be truthful about what vaccination really does. And it lowers your chance of severe disease by a significant amount. So it's worth being vaccinated, particularly folks like me that are approaching 65 very fast and are concerned about some of the risk on that. And that I just want to, maybe clarify that we need to be careful about speech on some of this, particularly as people hear constantly about the breakthrough cases with Omicron. Speaking of Omicron, we're now also hearing that unless you're wearing a KN95 and it's well fitted or an N95 mask, almost all of the masks most people are wearing nowadays are ineffective in preventing the spread of Omicron because it is that contagious. We've heard that from folks at CDC. We've heard that from folks at OHA. It's one of the reasons why they're, the Biden administration's distributing higher level mask. They bought a whole bunch of them and is going to distribute them by mail to people. So understanding that mask hygiene for young children is horrible. I would hate to, at lunchtime, go to any school, take the mask from children, give them a fresh mask, and culture those masks, knowing that they have to wear that mask for another several hours in the afternoon. We also understand that disease severity for young children is almost non-existent. Majority of cases in young children are asymptomatic. Hospitalizations are almost non-existent unless there's coexisting conditions like severe obesity. And, understanding that. And we also understand now that there is emotional damage being done to our children from masking. And there's also, we're inhibiting their development by masking and preventing that full communication of seeing facial expression. So my question for staff and the board is, when are we going to stand up and say mask mandates for children post-Omicron don't make sense and they're actually causing harm? And I think it's time for us to think about that. It's just an open question for all of us to think about. When do we unmask our children? Thank you.
Thank you, Commissioner Bozovich. Dr. Warren, Mr. Adams, any point? Thank you.
Thank you, Chair Farr. If I might, protecting the health of the community is accomplished through vaccination because it does protect our hospital capacity. And to the extent that we can reduce severe complications, hospitalization, and deaths, we are protecting our community by protecting our hospital capacity to respond to the other events and to personal needs in the community. So I think that that's where the community protection comes in, and it is really important that we continue to highlight that. Thank you.
Thank you, Dr. Warren. Then I'm looking for the queue for hands, and I see Vice Chair Trieger.
Thank you, Chair. Thank you for the presentation, Mr. Adams and Dr. Warren. I'm really excited to hear about the shift in operations with OHA taking on our mass vax operations here in Lane County and freeing up some staffing capacity for the mobile activities. I'm wondering, and also about how we're looking forward to getting back to the non-pandemic ongoing work of public health around reducing health disparities, and look forward to when the reports to the Board of Health are about our initiatives aimed at that more broadly and multi-pronged, so needed. But I'm also really curious if you can share a little bit now, or if it's something to bring back to us a little bit more about, is it equal capacity we were spending deploying mass vax clinics that we're now spending on these mobile, more targeted efforts, or if there's a gulf between, if we're spending a little less staff capacity, what we're doing with that, if those were temporary assignments that no longer apply, just how it's impacting public health overall from a workforce capacity and progress toward other goals, what that looks like. I'm also really excited about the mobile targeted opportunities, because I think it's a chance to develop some new and deepen existing partnerships with some of the community organizations that are working with these populations that we really need to reach. And I'm also wondering if the mobile clinic folks are equipped with resources to refer people to all of us having gone through this pandemic, but particularly I think folks that are finally getting to a place of trust and comfort to receive a vaccine at this stage have a particular load of stress and anxiety related to this pandemic and its impact. So I'm wondering what our mobile clinics are offering for resources for folks to get support for mental health, stress, and anxiety management. So there's a lot of questions all at once.
Thank you, Vice Chair. Dr. Warren.
Thank you, Chair Farr and Vice Chair Trieger. As far as staffing goes, I would say at the height of the pandemic, we had a much larger workforce, and that was funded as well by not just kind of federal funds, but also FEMA, and supported by, I guess, you know, an emergency amount of funding, which completely makes sense. We have had hundreds and hundreds of people in this response. And I was thinking about that when we were doing the recognition this morning of the rental assistance people. We have also had folks working in our call center, as was noted, and we've had so many people that have contributed to this response. It is a smaller group that do the mobile outreach, in part because obviously, you know, you want a smaller number of people in people's homes. We're not going to bring a giant team. It's a much more kind of intimate, if you will, approach. We are setting up, though, some of the people that we had working in those larger clinics are being redeployed to creating these smaller mobile teams. So we are still kind of setting up what that looks like, and they are working on their processes as well and ensuring that we have the right number of vaccinators, people doing the paperwork as well. Then there's all of the scheduling and the supply work that happens. We are thinking about what that looks like going forward too. Like, what will these are going to be our regular staff, and what are the opportunities for us to look at other health disparities and to work with communities to identify their health priorities and think about how we can address those in the community with these mobile teams. We do now have a beautiful mobile clinic that I think is going to make a big difference for us in terms of being able to be responsive to some of those more, you know, distant locations in Lane County. That we have always had services throughout Lane County, of course, but being able to bring some of the clinical services out to those folks, especially things like sexually transmitted infection and testing and treatment, some of the things that we are not able to do now, will be a great benefit, I think. And we're looking forward to that. So it's going to be fewer people, I think, overall. We could not sustain a public health department that was, you know, triple the size that we were going into this. And I think that's okay. I think that the need is a little different and is going to be, the response will also look different. And I'm excited to bring more information about that as that develops too. In terms of referring for mental health services, that's a good question. I know that certainly we work very closely with the community-based organizations, and they have a lot of work around responding to mental health needs. I would be happy to take that back to the team too and see what other resources are available. We do have a resource guide that we share with all of the community-based organizations, and that we have on our website too, that lists all of the available resources for a lot of things. Mental health is included in that, but we also have food resources, energy resources, etc. But I will get some more information on that too, because I agree that it's a significant issue, and I don't know exactly how they're working on that.
Thank you very much.
Sure. Steve, I don't know if you have anything you'd like to add about that one.
Well, Chair Farr, Dr. Warren, I think the only thing I would just add is, as Vice Chair Trieger knows from personal experience, we had a significant volunteer force on the ground, you know, throughout the mass vax phase. So there was, you know, there was an ability to leverage our existing workforce and deploy them in such a way that we could double or triple them by virtue of the volunteers who helped us with our larger scale operations. And of course, as we dial back that work, they're no longer required to do the in-home or the small scale activities, though there are ongoing opportunities for many of those. And we are working also as a lesson learned from this process to ensure that we have the capability within public health to very rapidly deploy volunteers to assist us in future for vegan activations, for instance, or for, God forbid, Cascadia. Those kinds of things that we have to think about and look forward to.
Thank you, Dr. Warren and Mr. Adams, for a string of concise answers to a string of questions. Well done. I'll move along to the queue. If Vice Chair Trigger, does that conclude your questions? Then moving along to the queue, I see no hands raised. I will ask a question or two myself. Personally, I want to give accurate information when people tell me things that don't sound like the things I've been told from people that I trust. And the people that I trust are the people who present these reports. I trust you because you have the credentials, the background, and also I have the experience in you being trustworthy. That means a great deal to me. So when people ask me questions or make statements that seem a little bit off what I've been hearing, I'll come to you, and you've been very good at providing me with direct responses. The question that really, I'm going to try and form this question. We used to talk about breakthrough cases. People now have, this is called a breakthrough case. We don't use that term anymore, or at least not to my ear haven't heard it. So there's no such thing as a breakthrough case anymore, right? Is that because Omicron has kind of ended that expression? I mean, there are people who have been vaccinated are contracting Omicron on a regular basis. Is that correct?
Chair Farr, indeed. So breakthrough, as currently defined, is the first and second shot of your primary series for COVID-19. Yes. So we are seeing very significant high numbers of individuals who are fully vaccinated, who are in fact contracting Omicron. What we are seeing is those individuals who are boosted, meaning that they got their third shot after some period of time, are more highly protected against contracting Omicron than those who are not. The differentiation here, I would note, is that we're a year into really understanding these mRNA vaccines. It is quite likely that 5 years hence, this is not going to be a 2-shot primary series. It's going to be a 3-shot or a 4-shot, as some of our other infectious disease shots are.
Thank you. So we're adjusting as the virus evolves, and we will continue to adjust, and apply scientific processes, scientific values to doing the best job that we can at all times. The thing that really stands out to me, and correct me if I'm not, when people ask me questions, if I'm not answering correctly, what vaccinations do absolutely is lessen the severity of an infection should you contract the Omicron or any other variant. I'm accurate in saying that. And
that is correct.
Very good. And I will continue to say that. And that is really the main thing. And Dr. Warren, you stated something that is really an important response for me also, and that is vaccination protects our community if nothing else, through hospital capacity. Now, there are other things, but hospital capacity alone is a tremendous benefit of the community that is delivered by vaccination. Those two things are what I'm going to take from this meeting, because we do get questions all the time, whether I'm walking through Albertsons or walking through Costco and the guy standing next to me doesn't have a mask. And I say, hey, where's your mask? I want to be able to give them accurate information that I can trust. I receive accurate information from these meetings that I can trust, and I use it. And I would encourage anybody else to do the same, because don't trust me, because if you don't have a history of me being trustworthy, don't trust me until you have. You do have a history of being trustworthy. I do trust you. And the information that we get here is information that I will pass along, and I will cite it as the truth. One quick other question, 71% total population vaccinated in the county right now, 71.5. What about pediatric? Does that 71.5, does that include pediatric?
Chair Farr, it does. So we are seeing growth in that number, more likely than not, from our pediatric population. We're currently at, for our 5 to 11-year-olds who just became eligible in the late fall, early winter, We're showing 36.1% for that population. For our older kids, 12 to 17, we're reporting 70.7% for that demographic.
Mm-hmm. Thank you. And thanks for the presentation today. I don't see any further hands in the queue. We do have a 10:30 time certain with the sheriff, but I'm going to say one more thing. This is kind of a strange little aside. Last night I was watching the Great British Baking Show, which I love. It's a great show. And the episodes that I was watching last night were filmed during the initial stages of COVID, when they actually, the production staff and all the participants were in a bubble, and you could see the stress on people's faces at that point in time. They didn't know what was going on outside. And I really look at, as we know more things, it relieves anxiety and relieves stress. So the more accurate information we can put forward, the less stress people are going to, there's still going to be stress. And of course there is. And when you hear of your friends contracting COVID, your family contracting COVID, there's going to be stress, but really, what I see in the general public today is an understanding, acceptance, and trusting of the processes that we're going through. And that's what I get from these meetings. And that's what I carry out of these meetings. And I want to thank you for that, because it really does give me a very significant way to respond to people who are presenting different information. And we have two new words. I found two new words in the last couple of weeks: plandemic and misinfodemic. Commissioner Burney.
Thank you very much, Chair. I just wanted to very quickly thank Dr. Warren, Mr. Adams, the entire team. I can't imagine how difficult it is for you as the landscape is constantly changing. And Dr. Warren, you said something which I think is really critical and bears repeating, which it's hospital capacity, which we are protecting, since so many of us have so many conditions. So many nurses are calling, and people from all walks of life are calling in sick. Maybe not as great a percent are dying or hospitalized, but a lot of people are calling in sick to the degree that's even impacted supply chains yet again. So as someone who actually has children and actually has grandchildren and can see the good, the bad, and the ugly of this playing out, and we will always have criticisms, right? Because unique circumstances, but you have remained focused on results and focused on solutions. About a little over a year ago, 0% of our population was vaccinated. You now are reporting 71.5%. We know that there are treatments now. So as the world changes, we just know you're keeping us healthy. As this county, and forgive me, I just need to remind, we don't make any mandate policies for the state, other than our own employees. All this public health department does is, one, educate based on knowledge at the time, and two, provide the option for families and people to get vaccinated if that is their choice. I think that has improved our health. I think we are starting to move through a different stage of this. And I thank you all so very much. And thank you, Chair.
Thank you, Commissioner Burney. Commissioner Bozovich.
Thank you. After your comments, Chair, I want to make sure I'm clear. I was not challenging the veracity of our staff. What I was trying to clarify was what's meant by protecting public health with vaccination. And I think previously it had been talked about flattening the curve and lowering the number of cases. And we now understand that that's nearly impossible to do with the Omicron variant and the highly transmissible nature of that variant. What I was referring to is, and I agree completely with staff, we are protecting that hospital capacity. And I even stated in my comments that it does decrease the severity of the disease. But I don't think anyone is challenging some of my other statements, which are Omicron defeats most of masks if they're not properly fitted and a high level of filtration. So cloth masks, some of the surgical masks. I know even when I wear a KN95, because of a certain facial feature of mine, doesn't fit well, still fogs my glasses up. It probably doesn't protect other people if I'm still fogging my glasses.
What facial feature might that be, Commissioner?
Eyebrows.
But you know, so the mask effectiveness is not quite, for Omicron is not being questioned. Mask hygiene for young children, I don't think is being questioned. Disease severity for young children, I don't think is being questioned. And the mental health aspects of masking young children is not being questioned. So the open question out there still is whether that's continuation of masking young children by mandate is a good thing public health wise for society. Yes, we don't control that. The state's made that mandate and is getting ready to make that rule permanent. But as an elected body and as elected officials, we can advocate against that damage being done to young children. So I know we can't take action against it, but that's all I was kind of asking that open question is it time for us to speak up?
Thank you for clarification, Commissioner Bozovich. And I personally didn't question your questioning of the staff. I took your questions as at their face value. So well done. I'll mention this. We have a few minutes before the time certain. Back in the 70s, I was in the U.S. Army and the Oregon Army National Guard, and we trained for an invasion. And in the invasion, the things that we trained for is called NBC was the main thing. We didn't train it for bullets. Everybody knows what bullets are and tanks are, but it's nuclear, biological, and chemical attack. So we train for NBC, and we train to shield ourselves from NBC. This is not unlike that. We find different ways to shield ourselves, and the threat actually comes from different avenues from time to time. What we thought was the main threat becomes less a threat in view of something different. And what we thought was the main value of the response becomes a little bit different because things do evolve. NBC is the same way. And there are three things that always protect you from NBC: time, distance, and shielding. And I think it's the same with virus. Time it'll run its course. Distance, if you don't come into contact with it, you will not contract. And shielding, use whatever shielding has been prescribed and whatever we know to be effective, what we trust to be effective. With that, Dr. Warren, Mr. Adams, and Mr. Mokrahajski, anything else from staff? Thank you very much for a great presentation, and we will see you again next week. And at some point in the future, we will hope that these, the Board of Commissioners joint meetings with the Board of Health will be less frequent. But for now, each board meeting will contain a separate meeting for the joint meeting. Thank you very much. At the sound of the gavel.
Excuse me, Chair, I see our administrator has his hand raised.
I'm sorry. Oh, no, that's okay. Yeah, I was actually going to just say the next item, we could take county administrator announcements, and we have Patience Winningham with us to discuss the 2022 World Championship Security Committee recommendation. So sorry, I'll let you go through that, Chair. I just was going to say, since we have 10 minutes before we get to the time certain, if you want to take up item 10A briefly, that would work great.
Thank you, Mr. Mark. Then at the sound of the gavel, I will convene the, I'll adjourn the joint meeting of the Board of Health, Board of County Commissioners, and reconvene the meeting of the Board of County Commissioners. Welcome, we are reconvened as the Board of County Commissioners, and Mr. Mark, we have a 10:30 time certain. I'll pass the agenda over to you to cover anything that we might be able to cover in the next 7 or 8 minutes before the time certain. Mr. Mokrahajski.
Thank you, Chair. And we have Patience Winningham with us, who is our emergency manager. So we have an item that just came up here over the weekend, and appreciate the board's indulgence. Patience, I'm going to turn it over to you. You sent me some information, but I think you'll be more informed to inform the board directly. So go ahead.
Great. Thank you very much, Chair Farr, Commissioners. I'm here today to ask you for a letter of support for the 2022 Athletic Championships event coming up here in July. We met, the security committee met on Friday, and we're putting together a SEER rating application, and we're looking for support from the board. It could be as simple as a letter of support, which I've already prepared, that includes all the information that you would need. And mostly what we've determined is we don't have an adequate resource in security personnel and other resources to meet the needs for an event of this size. That would also include other events that are being held around the same time. So we're putting together, again, a SEER rating, which is a special event assessment report to Homeland Security, and asking for them to provide federal assistance and state assistance to support us to meet that need. And that's what I'm here today for.
Thank you, Ms. Winningham. Any questions from the board? Then let me know, what action do we need to take at this point? Do you need just a head nod on that, or do we need a motion and just a head nod?
I think just head nods, and I think we could have the chair sign the letter. And I'm talking to Ms. Jones about whether or not it's an assignment, but we can figure that out. So I think just head nods works well if you support that.
And then with the consent of the board through head nods, I will sign that letter when it's placed before me. So head nods. You have it, Ms. Winningham. Thank you very much. Thank you again for all of your very good work. Yes, Vice Chair.
Question, is there anything else we need to do to make it happen in the time frame that you need, rather than it coming back to us again? Or is that what we just did by, okay, great.
Yeah, the letter of support, I'm really apologize that it's actually due this Friday to the state. So once I have more, I'll bring it back to the board.
Perfect. And I can do it either electronically, or I will be in the office at some point this week.
Thank you very much.
Then, Ms. Mokrajewski, we do have time right now for the consent calendar, I believe, and we will get back to your announcements 10A after the conclusion of this rightful time in the agenda. So at this point, board, we're still a few moments before our 10:30 time certain. We have before us the consent calendar for February 1st, 2022. Do I have a motion?
I'll move passage of the consent calendar for February 1st, 2022.
Second.
Moved by Vice Chair Trieger, seconded by Commissioner Burney. We have the consent calendar for February 1st, 2022. Any discussion to the motion? And I will remind us that anything that needed to be pulled would have been pulled by a commissioner or by staff. No discussion. I will call for the vote. All those in favor, please say aye. 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 Passes unanimously. Then we have a couple of minutes, Mr. Mokrajewski. Let's assemble the staff for our 10:30 time certain. And I believe today that Sheriff Harold will be with us. And the panel today will be you and Sheriff Harold and Peggy Kepler today, I do believe. Mr. Mokrajewski, I'm going to actually turn the mic over to you, turn the table over to you to introduce and begin the 10:30 time certain. A moment or two early. I don't think anybody objects to that, but we won't get into any action until certainly after 10:30. Thank you.
Thank you, Chair. Yes, and we have, you see Sheriff Harold is with us, and Peggy Kepler, Lane County Engineer, is with us as well. And I'll just make some brief introductory comments, and then I'm going to turn it over to the Sheriff and then to Peggy to add more detail. I think the initial comments that I want to just share with the board is that we've gone through for several years now, and of course the story of the lack of funding and underfunding of our public safety system here in Lane County is a decades-old challenge that we all are very familiar with, and it goes back to the heavy reliance on timber funding and then on secure rural schools, federal entitlement funding, and as those fundings and statewide policies and federal policies changed over the decades, that funding has declined by approximately 90%. So at one time we received about $40 to $50 million per year to the general fund and the road fund to support critical public safety, particularly rural patrol and other public safety services, as well as funding for maintaining Lane County's road assets. And as that funding has declined, of course, we all know the story of what's happened. The services, the public safety services, the patrol in rural areas and other public safety services through the Sheriff's Office and the DA's office and other areas, as well as investment in our road system, have declined. So we have for many years worked to stabilize our budget, to be able to stabilize the reduction in those services so we can at least maintain what we have. And the board, I believe, is familiar with the 10-year public safety plan that we have been working to achieve, and various parts of that system we have stabilized, and we've moved into additional phases of that 10-year public safety plan through the DA's office, through parole and probation, through youth services. And one of the remaining pieces has been in rural patrol that we have continued to seek to stabilize and to move into a future phase there. And at the same, so we've had these discussions over the last several years while we've avoided using one-time funding to fund ongoing services, we have looked at, and Sheriff Harold and Dan Hurley and I and others have looked at one-time funding to develop several years of investment in these different systems, in particularly in rural patrol. And so last year, the board did approve the use of one-time funding to develop a 5-year plan for additional investment in rural patrol. And as part of that conversation, our public works folks and who are responsible for maintaining our road assets, and oftentimes, as we know, there's contention and there's division in our organization, even when we talk about, should we fund public safety or should we fund road maintenance? And that's really a problematic conversation because we need to fund both. But because of scarcity of resources, it comes down to, well, which one is more important and what do we do? And I want to just say that I really appreciate that in the last couple of years, the sheriff and our public works team have really worked collaboratively to try to find the win-win, to try to find how do we recognize that both of these areas are critical investments for our community that we need to try to work together as a team to invest in. And so this proposal that we have, that I'm not going to steal the thunder from the sheriff and from Peggy, continues to build upon that approach of recognizing that we still have significant challenges in responding to calls for service in rural areas and providing just the basic public safety services. It also recognizes that our public works team and our roads need to have the ability to invest in maintaining that road asset before they deteriorate too far. That all is to say, we're not making the investments, even with this action today, we will not be making the investments ultimately that we need to have the robust public safety system and road maintenance system that we need to. But this is, we believe, yet another step in that direction. And I very much appreciate the work of the sheriff's office and our public works team to work together to further those efforts. So Sheriff Harold, I'll turn it over to you.
Thank you, Ms. Mokarski. And Sheriff Harold and Ms. Kepler, before you do, I'll read the order that we're considering today. We are considering Order 220201-02 in the matter of allocating $13.7 million in estimated road fund payments awarded under the 3-year Secure Rural Schools Act extension to improve rural patrol services, up to $7.2 million over 5 years, and to replenish road fund reserves and future territorial highway improvements, estimate of $6.5 million, and adding 5.0 full-time equivalent deputy sheriff positions, 2.0 full-time equivalent deputy sheriff detective positions, and 1.0 full-time equivalent deputy sheriff sergeant position to the general fund within the Department of Public Safety. That is what we're looking at, Sheriff. Thank you very much.
Thank you, Chair Farr and board, and Mr. Mokarski for that introduction. This will be the first time I've tried to do a share screen on the new platform, and so I can't see any of you now that I'm doing that. I trust that you can see my screen, and you'll let me know if you can't. We're going to go through just a few slides, and predominantly this is information, board, that you know, and that County Administrator Mr. Mokarski just shared with you, but just to sort of set the foundation on where we're at and what we're up to today. If I can advance the slides. There we go. So this is one that, of course, you've seen before and seen recently during budget kickoff. But just as a reminder, on the left side, we have the base property tax rate for county services for the counties in Oregon. The red circled counties are the 5 comparator counties for Lane County that we use. And of course, I generally share when I'm visiting with folks that Lane County is pretty unique, and even when we look at our 5 comparator counties, as far as being a county with a metropolitan population, but a previously timber funding dependent county. So even when you look at the 5 that we compare to, we're special. And then, of course, next to that is the history of the Secure Rural Schools funding, which Mr. Mokryski just went through, as it is decreased over time. The board will recall, I've shared before, from 2008 to 2012, just within the Lane County Sheriff's Office, we cut 200 positions and laid off 100 personnel. Thankfully, we did get the public safety levy passed, and then we were able to start recovering some of those, but certainly have not recovered all of those positions over that time. On this slide, again, we have our 5 comparator counties. And what we're showing here is the number of enforcement deputies, that third column over for each county, along with the county population. Just to clarify, when we talk about number of enforcement deputies, the Oregon State Sheriff's Association facilitates an annual sheriff's survey. And we really don't break out the assignment of the enforcement deputies. Primarily what we report on is the number of deputies assigned to the task of enforcement versus the number of deputies assigned to the task of managing a jail, which of course every sheriff is required to do. So what we have is a total number of enforcement deputies, and you can see Lane County at 65. So that includes not just our main office patrol, which currently has 25 budgeted positions, but it includes all of our contract deputies, City of Crestwell contract, City of Anita contract, Marine Board, etc. And then you can see on the far right there, we break that down in a number of deputies per 1,000 residents for county population. It's quite difficult to try to break out unincorporated county population. It's difficult enough just here in Lane County, but would be very difficult to do for our comparator counties. So we haven't tried to break out unincorporated population. I also think it's worth noting that the duties of sheriff are sort of unique in that we truly are required to serve the entire population of the county. We have deputies that are working inside the city limits of Eugene and Springfield and every other incorporated city in the county. But just talking about the 2 biggest cities, we have deputies that are working inside those city limits in order to provide the function of the sheriff that is to serve the circuit courts. And so we are the agency that's required to serve eviction notices. We are the agency that's required to serve protective orders, stalking orders, restraining orders. So we do serve the entire population of the county in that way, and in other ways as well. The sheriff's responsible for search and rescue, which many times involves folks who live inside of incorporated cities going outside the city in order to recreate, etc. So I think it's notable, obviously, our number of deputies per 1,000 is 0.17. The overall average of all 36 counties in Oregon is 0.30 per county population. And then you can see how we line up against our comparator counties. And that's, that average is less than 0.4, but above the 0.30 that's for all counties. I think it's noteworthy, Deschutes and Jackson are comparable counties, but with over 100,000 fewer population, but with a higher number of enforcement deputies, particularly Deschutes. As we know, Deschutes has the same property tax rate as Lane County when it comes to base county services. But Deschutes, in addition to that, has 2 tax districts. They have a countywide tax of 95 cents per 1,000, which funds the dispatch center, the jail function. And then they have a district of unincorporated Deschutes County that's $1.40 per 1,000, which funds their unincorporated patrol. It's also interesting to note, I think, Clackamas County, their base county rate is $2.98 per 1,000. Lane County is, of course, $1.28. But even on top of that, they have a public safety levy, a countywide levy that's almost 40 cents per 1,000. Similarly, Marion County and Washington County have levies on top of an already robust base property tax rate. So that certainly sets the scene on why we are at only 0.17, and not new information to any of you that it's a resource dilemma. So what we do have is for that unincorporated patrol, we have 25 budgeted deputy sheriff positions. And so most shifts, that's 3 deputies and a sergeant to cover the 4,600 square miles of the county. On the graveyard shift, we do drop down to 2 deputies and 1 sergeant from 2 a.m. to 6 a.m. We took a look at calendar year 2021. Our dispatch center entered 60,548 calls for service, which averages out to about 165 calls each day. And then we just wanted to take a snapshot here and take a look at a 4-hour block on an average Friday afternoon, 4 p.m. to 8 p.m. So the swing shift patrol deputies brief at 4 p.m. and hit the road from the main office here in Eugene. And this is what their calls for service look like starting at 4 p.m. And that's just one 4-hour block of time. On that same day, in a 24-hour period, there were 193 calls for service, so well above the average of 165. And those calls included all of the types of calls that you would expect a good police service response to, particularly assaults, domestic disputes, traffic crashes, menacing, really all of those things that are on the screen. So what's the result, of course, with the staffing we have? Oftentimes community members receive no response, or a response that really does not communicate to them that their call request is of importance. We took a look just at December of last year. Over the course of that entire month, we had 28 reports of assault. I don't have the breakout on how many of those were domestic assault versus a non-family situation, but I can tell you predominantly most of those calls for service do involve a domestic relationship. And in the month of December, our average response time to those calls was over 2.5 hours. So we've talked a little bit about the Public Safety Repair Plan. It's been around for quite some time. The Public Safety Coordinating Council took it over from what was originally led by county leadership staff to take a look at our public safety system as a whole. And of course, we know that it's really a pretty complex system that requires many different moving parts. And so that's the purpose of trying to take a look at it as a system. So in the Public Safety Repair Plan, we had 3 phases. The first was to keep what existed. The next was to address critical needs. And then phase 3, addressing all system needs. And you can see there all of the partner agencies that participate in this. In our most recent updated plan, it was announced that all of the areas have entered phase 2, so the addressing critical system needs phase, except for Lane County's unincorporated law enforcement response. The phase 2 goal that we've had in that plan, we've had since 2013. At that time, Sheriff Turner had the Police Executive Research Forum come to our organization to do an analysis and try and tell us if there was a way we could be more efficient with what we do have, given that we felt that we had limited resources. And so during that analysis, the folks at PERF told us that we should really have at least 30 general county patrol deputies just in order to continue to do the level of work we already were doing, in order to not have a risk of higher staff burnout and turnover rates. So we truly had this goal of 30 general county patrol deputies since 2013. It's been part of the Public Safety Repair Plan since 2013. I think it's noteworthy that the population of Lane County has grown by 10% since 2013. We've never adjusted this goal because we hadn't reached the goal. So we didn't do any population adjustment for the goal because we just wanted to get to that benchmark. So if we are able to restore general county patrol to 30 deputies, that's going to bring patrol up to approximately 68% of the 2003 staffing level and about 31% of the 79 level. Also, part of this request today is to add 2 additional detectives. This would restore our detectives section to 6 detectives. It's about 28% of the 79 level. But we do think it's sufficient to investigate most child sexual assaults as well as other Measure 11 violent felonies. And I believe that once we have these 2 additional positions, if they're funded, once we have them filled, I believe that's going to give us the ability to investigate some felony property crime. And we haven't had a detective available to work on any felony property crime for well over a decade and a half. So this would be significant for the folks who live in unincorporated Lane County that suffer a burglary, which of course is classified as a property crime, but feels very, very personal if it's your home that somebody came into. We really have had no investigative resource. We send a main office deputy, gets dispatched oftentimes They take that call by phone to cut down on driving time. They take the report, and there's generally no follow-up. If there is any follow-up, we expect the uniformed deputy, if there's some things that they could follow up on, we expect them to do that. But we expect them to do that while they're also dealing with the other 165 calls that come in every day. And so our investigative follow-up to property crimes is almost none. So this would be pretty exciting to be able to potentially have a detective to assign to some of those cases. So why do we get to be here today to make this request? Last year, as part of the Federal Infrastructure Investment Act, there was a renewal of SRS funding for 3 years. And it was specified that it would be at the federal fiscal year 2017 level, in addition to the other funding for infrastructure needs. So Lane County budget staff has calculated that this SRS renewal will result in an estimated $13.7 million over the course of the 3-year renewal. And of course, the ORS provides that payments from timber or SRS payments received by a county can be used for county patrolling, which includes responding to calls for service by a county law enforcement official. So with the passage of that act and the renewal of the SRS, myself and County Administrator Steve Mokrahysky and Dan Hurley, Public Works Director, got together, visited about this SRS renewal and the estimate of what it would bring. And we come jointly together to you with our request for how to allocate that funding. So the request for the Sheriff's Office is about the request is 7.2 million, which would provide 5 years of funding for the following FTE. Would be 5 deputy sheriff FTE, which would bring our county general patrol up to that 30 goal that we've been shooting for. It would be 2 detectives, as we just discussed, giving us the ability to do a little bit of property crime follow-up. And it would be an additional supervisor for those positions. With that, I'm going to turn it over to Peggy to discuss the Public Works part. And Peggy, if you'll just give me a next slide prompt, I will advance the slides for you.
All right, thank you, Sheriff. So Public Works is requesting the balance of the SRS allocation, replenish the road fund reserves, and fund the future territorial highway improvements with $2,569,000 going towards the service stabilization reserve and $3.9 million going towards the territorial highway sub-fund. Next slide. The service stabilization reserve was established and defined in Board Order 18-08-2801. The 8% of the operating road fund revenue was set aside for this service stabilization fund. And the purpose of this reserve was to reduce the impact of the revenue fluctuations and economic downturns. $2.6 million of the service stabilization reserve was utilized during the first year of the COVID-19 pandemic due to reduced state highway fund revenues. Next slide. And in 2019, Lane County accepted the jurisdictional transfer of Oregon 200, which is the territorial highway, from ODOT. The agreement that we had with ODOT was to exchange territorial highway, and we accepted $30 million towards the improvements that we could do on territorial highway over a 5-year period. Territorial highway is our highest fatal and severe crash highway on in Lane County. It's a narrow, winding, principal arterial roadway, and it has several landside areas. We have multiple failing fish passage culverts, and it's 28 miles of failing pavement structures. The entire length of the road is 42 miles. But we have a lot of work that has to be done on this road to bring it to a maintainable condition. We're in the process of completing our capital improvement plan for that roadway. Our estimate of improvements is $60 million. We finished repairing one slide at Stony Point, and that cost is $5.4 million. And we're working at trying to figure out how to implement the monies that we have available and continuing to look for future funding. So with the monies from these reserves, we will be putting them into that sub fund. Thank you.
Board, that's what we have prepared to share with you all today. Would love to answer some questions, and I will leave the screen share up if anybody wanted to see one of the slides again. Otherwise, I'll put it down so I can see you all better.
Thank you, Sheriff Earl, Ms. Kepler, and Ms. Brogaisi. I'll turn it over to the board for the queue, and we'll begin with Commissioner Bozievich. Commissioner Bozievich, you spent a lot of years on our PSCC. Please go ahead.
Thank you. So I first want to take a minute to thank Tim Freeman and the Association of ONC Counties for their tireless work to get this piece of legislation inserted into the infrastructure bill. It was, mostly their efforts that were successful in doing so, particularly at the 2017 levels. So thank you, Tim and AOCC, for this opportunity. And I also want to thank them for the work they did to get a resource management plan withdrawn and is being rewritten at this point that may be able to provide us a level of funding to continue this well beyond the 5 years and actually increase that if we get to sustain yield harvest of our ONC lands. That all said, I have two questions, one for the sheriff and one for Ms. Kepler. Sheriff, have you spoken with the DA and the Public Defender's Office, knowing that the City of Eugene is also increasing their patrol and detective services, about the balance of workload coming to those offices? I know we're not responsible for funding the public defenders, but they've been in the news recently about how understaffed they are. And our DA's office is also dealing with the COVID backlog and trying to make up as we staff up detectives and patrol deputies. That means caseload for both offices. Can you briefly maybe address that?
Yes, absolutely. Both Brooke Reinhardt with Public Defender's Office and Patty Perlow participate with Public Safety Coordinating Council, and so have participated in the Public Safety Repair Plan. So we've had this conversation over time as we've continued to have the goal of getting to phase 2. DA Patty Perlow has several occasions mentioned that the Sheriff's Office getting to phase 2 would not have a significant impact on her operation with the addition of 5 deputies and 2 detectives. That said, there is certainly a level of concern overall with the DA's office, particularly because of the number of officers anticipated to be added by the City of Eugene with the Community Safety Initiative. So there is a concern about the staffing of her office, but she's numerous times said that this phase 2 effort for the Sheriff's Office would have negligible impact. I can say I haven't directly asked the Public Defender's Office, Brooke, about our phase 2 ad. He has participated in the conversation 2 or 3 years now as the PSCC has considered the Public Safety Repair Plan. But I don't have a direct answer to that part of the question.
Thank you. I just want to say that I really support this, because I believe one of the things that we're creating with our lack of patrol services in rural areas and our follow-up on some crimes is the continuation of people going down the road of severe mental health problems and substance abuse disorder, to the point where they get, damage that's almost unrepairable, and intervening with those people early on in their criminal careers quite often can put them on a path to recovery through diversion programs. But we're not getting to these people early because these minor crimes aren't getting investigated and responded to. So I really appreciate your work on that. Ms. Kepler, the question I have, and as much as I support Territorial Highway, seeing I drive it constantly from end to end, sometimes towing an Airstream trailer, which is challenging. So my question for you is, we have had presentations from Public Works about a potential stormwater fee. And with this additional funding, I was hoping to avoid asking homeowners to pay additional fees for stormwater, as federal forest dollars have limitations, but all of our stormwater systems are within road right-of-ways and I believe are eligible for utilization of these funds. Will this help us prevent the need to ask homeowners for a stormwater fee?
There's an ongoing cost for the stormwater fee. So at this point, we have not looked at that cost because it will be ongoing costs. There may be some costs that we will be looking for stormwater infrastructure improvements, which we will be using road funds to improve the infrastructure, but not the ongoing costs.
Hopefully the new resource management plan by BLM for the ONC lands will provide us with sufficient income to maybe balance that, where we won't have to be using so many U.S. Forest Service dollars transferred into the Sheriff's Office for Public Safety. So we'll see how that plays out, but it looks like, that's a concern of mine. I just wanted to put that out there. Really appreciate the presentation. I support moving ahead with this. It's been a long time in coming. And I, again, just want to thank Tim Freeman and the Association of ONC Counties.
Thank you, Commissioner Bozovich, and thank you again for your many years of service on PSCC, providing valuable, insightful, accurate information. I'll move to the queue, and we have Commissioner Book.
Thank you, Chair. Raising your hand, lowering your hand, everybody moves around. I want to thank you all for putting your heads together and finding a great solution for SRS funding in this round. We are certainly appreciative of a congressional delegation that worked really hard, not only on the transportation package, but also being able to insert the SRS funding within that package. I know that Senator Wyden was instrumental in that, and for that, I'm sure many communities are thanking him right now and doing the same thing that we're doing, is trying to determine what we'll be funding. Since it sounds like in 2014 was the last time we've had some significant investment in patrol. We did add the 2 deputies on the east and west side right after the Holiday Farm fire. We were able to include funding in our recent ARPA allocation of over 17 million for the jail, and now able to add with this order another 8 members to your team. I'm extremely proud that we're able to do this investment, knowing that you've been very patient trying to wait for investment coming, and you've needed it for a significant amount of time. We know this won't get us completely up to where we'd like to see, but I think this will make enough to make a real difference, that people will see a difference in call time and response time. You'll see differences within, hopefully, efficiencies within your jail system with the upgrades there as well. I couldn't be more proud of what you are putting forward to us today, and extremely supportive. So thank you for doing that. Each year, it's a little bit different in what we are able to invest in our SRS funding, but this is a significant amount of money, and I couldn't think of better places to put it. Our road fund certainly needs the investment. Since we've had COVID, that funding, its traditional route of gas tax is hard to come by, and we haven't fully recovered. I know there's more investment from ODOT coming our way, but we're going to have to really fight for it. It's going to be extremely competitive. And I know that our road team is looking into that as well. So thank you for that as well. Thank you.
Thank you, Commissioner Buck. Commissioner Burney.
Thank you, Chair. Sheriff Harold, you and I have had a few sort of strategy conversations in the past, and it feels gratifying to see all of this starting to come to fruition. I, with the other commissioners, am thankful for everyone and anyone that contributed to Senator Wyden and our congressional delegation getting this in. And it is in, and we're delighted. I also know, having spoken with you and Mr. Hurley, that often, as Mr. Mokrahysky said, there's competition internally because it's scarce resources. So the fact that you both are coming to this body with a singular recommendation speaks volumes to the professionalism and dedication of both of you. I remember when I came on this body, I thought, and you can correct me if I'm wrong, Sheriff, but I thought I heard a statistic from your predecessor that it took about an hour and a half because of the disinvestment in deputy sheriffs to respond to calls. I saw in your presentation 2.5 hours. 1.5 hours, as we all know, is too long, especially given the emergency nature of some of the calls that you identified. Has the response time gone up, or did I not understand that correctly?
You're remembering correctly, and the 1.5 hours came when we did a 1-month analysis during a budget presentation 1 or 2 years ago.
Right.
And our system's currently, well, it's sort of a hand search to do that 1-month analysis. And so we looked at, for this presentation, we looked at just December and did a hand search for assault calls. And for this time of a 1-month snapshot, it was 2.5 hours instead of 1.5 hours. We are working on our technology within our computer-aided dispatch system to hopefully be able to do a better job of data analysis, and instead of doing a 1-month snapshot, be able to provide comparisons year over year. So that's one of the efforts that we've been engaged in, along with technology services, is improving our technology within the office to do a better job. But you are right, we've done 2 1-month snapshots that were separated by about a year. The first time it was for that month, an hour and a half. This time it happened to be 2.5.
Thank you, sir. So I have no questions beyond that, none for you, Peggy, but I'm enthusiastic that we're moving forward in a pragmatic way, and yet a half an hour feels like too long, right, for response time for some of these calls. And whenever the chair is ready, I'd be delighted to make a motion.
Thank you, Chair Burney. I'll call on you when that time occurs. Should be soon. Vice Chair Trieger.
Thank you, Chair. Thank you for the presentation. I'll just echo what was said before of appreciation for staff working together. Just a quick question, and forgive me, Sheriff, if I'm apples and oranges-ing here. Been navigating back and forth to the public safety repair plan, which in phase 3 calls for 50 deputies ultimately to allow us to increase minimum staffing and meet needs. So how much closer do these 8 additional deputies get us to that ultimate goal, or is 50 not the right number? Am I comparing things that don't belong together?
No, actually, you are exactly on point. For us to be an average Oregon Sheriff's Office to get to that 0.30, we would need to add 55 positions today. So that's roughly the 50 that you noticed. So sounds like we're gonna add 8. So we just need about 47 more to be an average Oregon Sheriff's Office.
Thank you.
Thank you, Vice Chair Trieger. I see no further hands in the queue, so I've got a couple of quick things, and then I'll call on you, Commissioner Burney, when it's time for the motion. You know, Sheriff Harold, I'll direct this to you. In March, on March 29th, we're going to be talking about the Sheriff's Levy. We're going to be reviewing the audit of the Sheriff's Levy. And the Sheriff's Levy, part of the language of the levy requires an audit that ascertains that we're spending money on the Sheriff's Levy money, not supplanting general fund money that would otherwise have been given to the operation of the jail. So we'll get that audit. It'll be a clean audit. Once again, I'm convinced of that. My question for you is, as we reallocate this money for phase 2, what, if anything, will that do to the sheriff deputies? Now, this is for patrol. and patrol has a pretty broad range of duties. What will it do to our ability to respond to domestic violence, to restraining orders, to felony burglaries? Can you just brief? Will that have any effect? The sheriff's levy will not. It is strictly for the jail operation, and that's the language is very, very strict, and it will be audited. What about this?
Yeah, I appreciate that question very much. What we anticipate once we have these positions trained and deployed is that we'll be able to increase our minimum staffing from 3 deputies and a sergeant to 4 deputies and a sergeant. Doesn't sound like a lot, but I actually was just visiting with some of our folks about this, and I remember my days as a patrol deputy coming into briefing, and our minimum has been 3 deputies for a very long time. And the day you came into patrol briefing and there were 4 of you there instead of 3, you started the shift just feeling good, because we would call that fat. We were fat that day because we had an extra body. And it really makes a difference when you're out on patrol. The difference of 3 of you covering the county or 4, it makes a difference in your attitude for the day. It makes a difference in your ability to respond to calls. You know, oftentimes domestic dispute, for example, we're not going to send 1 deputy to that call. That's a 2 deputy call. And so sometimes you have a deputy free, but no one to go with them. And so, you know, we call the state police, see if they can help, or a local city police agency, see if they can help. The difference, again, by having 4 is you're going to cut into that response time, because you're more likely to have an individual or 2 deputies available for that call at the time. So it's going to make a difference on a person by person basis. You know, the person who calls for help and gets a faster response time maybe didn't know that they got a faster response time than they would have if we didn't have the additional body. But it is going to be significant, and it's really going to be significant for the folks that we have doing the work, who day in and day out come to work and they see 20 or 25 calls pending on their screen, and that can feel pretty overwhelming, and it can wear you out, and it can make you feel, yeah. So having this boost is going to be a big deal for those folks, not only initially when they find out about it, but daily when they come in and there's more hands available to do the work.
Thank you for that, Sheriff. I kind of threw you a softball. I pretty much knew the answer to that before you went into it, but I wanted you to say that out loud, because a lot of times you might think of rural patrol as cops in cars making speeding stops, but it's far more than that. It's people responding to the needs of the people in the community. You know, a county of 380,000 people stretch from the top of the Three Sisters to Cedar Head Lighthouse. What a big task. Oh my gosh. And thank you very much for that information. Ms. Mokrajski, I see your hand is raised. I have one more quick point before I move to Mr. Mokrajski and then to Commissioner Burney. And that is regarding the effectiveness of our congressional delegation. You know, Senator Wyden has been in his office for right around a quarter of a century right now. And Congressman DeFazio has been in his office for 33 years, I believe it is. Right now, that's a lot of time to spend in Washington, D.C. And in that time, you begin to know really closely what it is that people in the communities you serve need. And one of the best ways that the congressional delegation gets their information is from the experts, or people who spend most of the time on particular issues inside of our communities and report it to their staff. Now, each of our congressional delegation has large staff, and the staff is there to provide them with great information so they can make the decisions that really most closely affect the people who they are serving in the communities, whether that community is Lane County, the full state of Oregon, whether it's Eugene or rural Lane County. And the bodies that serve as lobbyists, for instance, to Congress, are the ones who provide information. I spent time in the House of Representatives here in Oregon, and I had a staff much larger than I have here as a Lane County Commissioner, but not as large as congressional staff. And what my staff did is they gave me information regarding the decisions that I had to make. And I think that is one of the reasons that Senator Wyden has been so effective. And that is one of the reasons that over 33 years, Congressman DeFazio has, and Senator Merkley is, and others in Congress, because they listen to their staff, who listens to their constituents, who have the expert advice on how to guide the senators or the representatives' decisions. I believe that the Association of ONC Counties is such an advice-giving body. And as Commissioner Bozevich pointed out, they were instrumental in providing information which provided the money for the decisions that we're making today. Now, we'll talk about our membership in association of Oregon counties at some point, perhaps. That's not in my power to direct, but we probably will at some point. And when we do, we'll talk about how effective bodies are providing accurate information to the staff who presents information to their elected officials who make decisions that affect every single person in their communities. With that, Mr. Mokarasi, I'll turn it to you, and then after that to Commissioner Burney for a motion.
Thank you, Chair. And just a couple of brief comments. The overall sentiment that is being expressed here, that we're doing good, is the right sentiment. It's the right feeling for you all to have. I wanted to just make two brief comments. First, absolutely, recognition and credit to our state and federal partners for making this funding available. Absolutely a credit to our team internal to Lane County and the Sheriff's Office and Public Works and our budget team and working together collaboratively. And I also just want to make a point about the focus in the last several years here in Lane County has been to create a structurally balanced budget where our ongoing revenues meet our ongoing expenses. And part of what we've been trying to do in creating that structurally balanced budget, which I think now we're going on 5 or 6, hopefully 6 years with next year's budget, that we've been structurally balanced, is that when we receive these one-time resources, these funds from the state or federal government that are discretionary, that we don't expect, that we then can make an investment in a critical service area to enhance. And that's what we're doing here. Prior to that, Lane County we were relying on these SRS payments to fund the gap in our budget. And so it would be like paying your mortgage with your IRS tax return, right? It's not something, you don't know what it's going to be every year. And so relying on that for your ongoing expenses is not a good practice. And so we very intentionally have said in this organization, let's structurally balance the budget. So we have the resources to pay for what we know we need. And then when this day comes that we're able to work with our state and federal partners and internally to find new resources, that we can then make an investment that adds additional value to the community. And so I just want to make that point again about, we talk about budget and structurally balanced budget and people start falling asleep and snoring, but it's really a critical piece of being able to have these moments right now where we feel good about the investment that we're able to make. And then I'll make another final comment about this is a 5-year plan, right? And so we've also said one-time money, one-time expense, and we've deviated from that in specific examples where there's a critical service and we could demonstrate the resources to make an investment over a 5-year period of time. It's not unlike a levy that we would go out and ask the voters for, like the public safety levy that is so critical to funding the basic services out of our adult corrections facility and our youth corrections facility. So it's like that, but it is a 5-year plan. And just like the 5-year, the public safety levy that we're going to need to ask the voters for again next year, we're going to have to come back and deal with how we continue to fund these critical services and positions in 5 years. So I just want us to keep that in mind. It's critical for us to maintain a structurally balanced budget so we can have these opportunities to make investments that add value for the community. And it's critical that we remember that these are windows of time that we're investing, and we're going to need to come back to come up with future plans. So thank you.
Thank you, Mr. Mokarasi. And before I ask Commissioner Burney for the motion, Sheriff Harold, Ms. Kepler, anything you'd like to add prior to the motion? Thank you both. Thank you all three for your presentation today. Commissioner Burney.
Thank you, Chair. I am very pleased to move approval of Order 22-02-01-02 in the matter of allocating $13.7 million in estimated road fund payments awarded under the 30-year Secure Rural Schools Act extension to improved rural patrol services up to $7.2 million over 5 years, and to replenish road fund reserves and fund future territorial highway improvements estimate of 6.5 million, and adding 5 FTE deputy sheriff positions, 2 FTE deputy sheriff detective positions, and 1 deputy sergeant position to the general fund within the Department of Public Safety.
I'm sorry, I missed that. Could you say it again?
I honestly thought that I was muted when you said that. I was sweating.
Moved by Commissioner Burney, and I will not recite that. Seconded by Commissioner Bozovich. A discussion to the motion. I see no hands raised for the queue, then I'll directly call for the vote. All those in favor, please say aye.
Aye.
Any opposed? Passes unanimously. Mr. Mokryski, thank you. Sheriff, Ms. Kepler, thank you very much. Big moment in time.
Thank you all very much.
Thank you, Sheriff. Thank you, Peggy.
Then we will move down our agenda, and we have already completed the consent calendar, so we'll move along to County Council. Mr. Dingle, are you with us? Yes, there you are. Mr. Dingle.
Morning, Chair Farr, board members. I have no announcements today.
Thank you, Mr. Dingle. I'll bet you have a lot. You're just suppressing them. Just kidding. County Administration, Mr. Mokryski, you started with one announcement, but I believe you may have more. Mr. Mokryski.
I don't have anything pressing at the moment, Chair. So if there are any questions on any issues, happy to answer those, but nothing more.
I'll look to the electronic queue for questions from Mr. Mokryski. I have none. Then moving along to executive session, we have no executive session this morning and none this afternoon. Any other business for the order of this morning's agenda? I see none. At the sound of the gavel, we will recess and we will reconvene at 1:30 in regular session. That's the gavel.